And as promised, we are talking with Dr. Tim McKnight this morning. And welcome in, first of all. And you came to my place, but now we need to find out how I can have a better experience coming to your place. I mean, is that possible? Can we do preparation and be ready for our doctor's visit?
Yeah, I think so. I was at the dermatologist a couple weeks ago, and I was thinking, what do I need to know when I leave this visit, and what type of questions do I need to have answered? So there was some preparation for me, but when you're visiting your primary care provider in particular, you're doing a couple things. I think you're going in with a concern or a problem, but you want to come out educated. My belief is that we're not dictators. We're educators. We're there to help you understand what's happening and how to get better or how to improve your health. So when you leave, you should have a few ideas of things you can do to improve your blood pressure or to lose weight or to get better control of your blood sugar or manage your back pain. So don't just come in with this idea, I'm going to tell them about this problem, this problem, this problem, because the more you talk about all these different problems, the more our minds are scattered, try to address this, this, and this, but we can't address any of them to any degree where it's really going to be helpful. We can basically nod our head like, yeah, that's a tough one. I understand that. But then you're right on to the next issue. So a couple of things that as I was thinking about this, I think the listeners need to be aware of. First of all, come on time. Most offices have a policy that if you're 10 minutes late, 15 minutes late, you're going to be rescheduled. Every now and then, there's some type of an extenuating circumstance where we'll try to work you on a spot if there's an opening, if you come too late. But most offices, you're going to have to reschedule. And in our offices, most of us see patients every 15 minutes, but there's some offices that it's every 8 minutes, every 10 minutes. These are usually physicians who are employed physicians, and their employer has sort of said, this is your goal, this is your quota.
Yeah.
You've got to see so many patients in a day. And I personally have a hard time seeing more than 20 patients a day. I have a hard time with every 10 minutes. I don't think it can be done.
Well, yeah, I'm uncomfortable with that because you're skipping over details that might be really important.
Absolutely. So let me just explain what happens when we get behind, because we have some patients that they'll wait for 45 minutes in the waiting room and they'll leave because they say their time is valuable and they're going to reschedule. And so I understand that, but we're not getting behind to make you wait longer. I get really uncomfortable when I'm more than 30 minutes behind, and I'm always aware of the time. But yesterday somebody came in, and I said, "How you doing?" And she said, "Well, I'm doing the best I can," and that just opens up this whole story about her sister getting COVID and having underlying issues and being in the hospital for months. And she wanted to go through this whole story, which was horrific. And she's still mourning. And after 10 minutes, I'm thinking, okay, we've got 5 minutes to go here or less by the time the nurse gets you in and gets your vital signs and takes your other information. But could I cut her off in the middle of that story that's important for her to get out?
No.
I mean, I can't. I can't say, oh, wait a minute. You just spent 3 minutes talking about something that doesn't have to do with your health. We got to move on. That's terrible to do to somebody.
But it does have with her health, right?
It does
Mental
have something
health.
to do with her. Absolutely. It helps me understand where she is with the treatments that I'm giving her. So I really need to hear that. But what we need to do is maybe we just take that whole session to talk about that and say, let's get you scheduled back. But some of us are scheduling 6 to 8 weeks out for follow-up. So it's not that simple. So we have to do the best we can. So before you know it, you're 45 minutes behind. I do procedures. Sometimes the procedures, there's an issue and it takes me longer. There's sometimes somebody comes in and I'm waiting for critical lab work or for papers from another office to really understand what's happening, and they're not getting it, and we have to make a call and it has to be faxed. So there's all kinds of things that delay us. Believe me, we skip lunch when we're delayed. We miss things at home in the evening because we're still in the office. We don't want to be that way, but sometimes there's just no way around that. So come on time and understand that we're doing the best we can with our time. And then, as I said, come to talk about your problems, but to listen and to ask. So it's funny because when I went to the dermatologist, I had a few questions, things I wanted her to see. And there was one particular spot that I had on my arm for a while. And I asked her what it was, and she answered me, but I was so caught up in the other questions and the other things that I needed to do to keep my visit under 15 minutes that when I walked out, I said, what did she say that was? Because I'd never heard of that particular skin condition. So I'll have to go back the next time and write it down. So come prepared to talk and to listen, because I didn't listen well enough in that setting. And then I think it's really important, especially for people that have a lot of different chronic problems with their health. Don't come to a visit with a long list of all the things I want to talk about, because there's no way we can address all of those. Come with maybe one issue that you're most concerned about. And people come with different things. They think they've got cancer because they feel a bump, and that's a huge concern. Or they're worried about a lab value. Okay, that's your issue. If we can relieve you and answer that question, that's great. But as your provider, I'm concerned about keeping you healthy. When was your last mammogram? When was your last colonoscopy? So we have things that are maybe not urgent, but important for your health. Let us do our job to keep you healthy and to try to help you stay healthier or get healthier. Does that make sense? Because, boy, sometimes the list is just on and on and on. And we think we're done answering 2 or 3 questions, and we're about ready to walk out the door. Oh, I've got 3 more things here. And can you take this off? And can you do this? And sometimes we'll sit back down. Sometimes we'll say, we need to reschedule.
Yeah.
But that's a tough one. So don't overwhelm your provider with too many issues in one visit.
Could you kind of list them by importance on your way in and say, if we can get to this one and this one, then that would be
and that would be smart. Like I've got 5 things on my list I want to talk to you about today. Let me just read them to you, and then you help me decide which ones we need to. Yeah. That would be a good way, because then you're both on the same page and you're agreeing. Because in the back of the provider's mind, they've got a few things that are maybe you don't see as important, but we recognize is really important that needs to be touched on. And believe me, those 15 minutes go quickly, especially when we're counting the time that the nurse walks you back and puts you in the room and gets your blood pressure and checks your medications.
And the 5 things might have a link, or some of them, right?
Oh, sure. Yes. So I always want to address your concerns. If you're worried about something, I want to make sure we address that, because really that's why you came in. But sometimes that doesn't come up until the very end of the visit. So bring that to the forefront right at the beginning, and then let us look at that and then try to triage what the most important issues are. Another thing that really is a hamper to an office visit is when you come in and we're checking your medication list and you don't know what you're taking. And you think and you can't. And you're calling your wife and say, "Hey, can you look in the medicine cabinet?" Or they'll say, I'm taking that yellow pill. It's the yellow oblong pill. We have no idea what that is, because one medication can have different colors and shapes based on the manufacturer. Right. So either bring all your medications in and make sure you go through and you verify, yes, I'm taking these, or come with an updated list. If you're taking a couple medicines, you should have an updated list always on your person, so there's never any doubt. And if you're an elderly person that's struggling with that, come in with a family member and charge them with making sure, because one of the worst mistakes we can make is assuming you're on a medication that you're not, or stopping a medication that we thought you're taking. That will just derail the whole visit, because sometimes these medications are critical. And then, as I mentioned, the other thing I think you can do is organize and update your lab values. I try to print out your test results, your lab values, so you can walk out with them. Some people don't really care to have them, but some people want them. I think it's important if you can make a spreadsheet or have some type of a notebook where you've got those written in, and we can glance at that from time to time, especially when it's a chronological history. That can be really, really helpful. I'm always trying to do that. If you come in with a blood count from a health screen, I look at that and it may be normal, but if I compare it to last year's health screen, if I've got that available, that can be a real clue that there's something going on.
Trending then.
Absolutely. And like PSAs, you're aware of those for prostate cancer. We want to see the trends and the changes. So sometimes it takes some time for me to look that up in the chart or someplace else in the medical records. But if you've got that can be really helpful.
And it is your body, so you should take care of that.
You should be aware of those things, even if you might not understand them all. And when you come in with pain, think about how you want to describe the pain. As a physician, we've been trained with, there's an acronym called Codiers. And I was telling my wife about this last night. She said, don't use big words. That's not a big word. It's an acronym.
Yeah.
But Codiers stands for chronicity. How long has it been going on is the first one. O is for onset. When did it start? D is for duration. How long do you have pain during the day? I is for the intensity. People can't often explain their pain. Is it sharp? Is it burning? Is it dull? Is it aching? Is it constant? Is it come and go? So think about how you want to use those words to describe it. And then E is for exacerbation. How long has it been going on? Or I'm sorry, what makes it worse? You sit in a certain position or you move this way, it's better or it's worse. R is for, trying to remember what R is for. What relieves it? What are the relieving factors? Okay. And then S is for how does it impact you socially? Can you not sleep? Is it a pain that you just can't? You're talking to somebody and all you can think about is the pain, or you're not going out because you have pain. So I don't want your listeners to think they've got to remember this acronym, but think about how you want to describe this. Yeah. And those are the things that we're trying to pull out of you. So when you're coming in with pain and your blood pressure and your blood sugar and all these other issues, but pain is the acute problem of the day, we got to take time to understand that, because most of the time, if you get a good history and you ask enough questions, the patient will manifest their problem before you have to do any tests. But if we don't ask enough questions, we don't listen, we can be spinning for weeks with an x-ray and with a blood test and follow-up test. You mean you said this? I thought you said this, or I heard this. So we've got to take the time. So you can't overwhelm us with all these other issues in one visit. So, and then just finally, I think most people understand that there's different types of office visits. There's an acute visit where you come in with one problem. Those are usually, we like those because it's usually straightforward. Yeah. Then there's the chronic care follow-up. We're going to go over a couple things. And usually those visits are 15, maybe 30 minutes. If you're a Medicare patient, there's an annual Medicare examination that is paid for by Medicare, because the goal of that is to keep you out of the hospital, to make sure we know what your medications are, your immunization status, when was your last preventive testing, all those things. We screen you for depression and for substance abuse issues. All that is designed to keep you healthy. 80% of your health care dollars are spent in the last 6 months of your life in and out of the hospital with testing. And they save money and we save time if we can stay on top of those things. So that is a valuable visit. Take advantage of that, because often we call them patient navigators who do these visits. They're also there, and they're going to say, hey, we see you're on this medication. We know it's costing you $100 a month. We've got a discount card or a coupon we can give you. Let me help you out that way. So those are don't pass up on those opportunities. So hopefully those are some pointers that would help listeners to make it a productive visit where you feel heard and understood, that you're not feeling rushed, but we're covering the things that are important. And, you always come back.
Right.
So I know it's tough. It's tough to be a patient. It's tough to be a provider who is trying to take care of all these people with various problems. And sometimes, somebody will walk out of the office and I'm like, I just don't know what's going on. Let me do this and this and I'll bring them back. Or maybe I need a referral. But as I said, most of the time, if we have a good open discussion and we're both listening to one another, we have a good plan leaving the office. And that's always what I want.
That's the thing. Whether you're a boy or a girl, follow the Boy Scouts and be prepared.
Be prepared, yes.
All right. Dr. McKnight, thank you so much.
You're welcome.
That is Dr. Tim McKnight on our Talk with the Doc this morning.